Welcome to Thursday's edition of COVID-19. Our daily tally stands just below 400 today as we count down the hours now to the start of public inoculations tomorrow morning. Accordingly, we have more on the do's and don'ts with regard to the inoculations in today's coverage. Here first is Kwon So-ah with the pandemic updates. So I hear we've marked a slight decline in daily cases here in Korea today.
Yes, we have, Sunny. We're seeing a drop by around 40 cases compared to a day before, with 396 infections reported as of 12 a.m. this Thursday, and that includes 369 domestic transmissions, which is down by almost 50 cases from Wednesday. Now, Korea has a total of a little more than 88,500 infections, and the death toll stands at 1,581. Now, small and big cluster infections continue to grapple the metropolitan region. Here, still triple digits in Seoul and Gyeonggi-do province, and also double-digit figures scattered across the country. Here in Gwangju, meanwhile, more cases are linked to a cluster infection at a call center.
I see. So meanwhile, how are preparations coming along for our vaccination campaign tomorrow?
Well, Sunny, with just a day left until the vaccination program kicks off here in Korea, hundreds of thousands of AstraZeneca vaccine doses are now being distributed to all corners of the country, including Jeju-do Island. Now, here on the mainland, the distribution process began past 5 a.m. Thursday morning, with over 50 container trucks having departed from a cold chain warehouse in Gyeonggi-do province's Icheon, where the first batch of the vaccines arrived a day ago. 1.57 million doses, which is enough for 785,000 people, are set to be delivered to around 1,900 public health centers and nursing hospitals over the next 5 days to be administered to medical workers and patients under the age of 65 beginning Friday. Now, what we were also expecting to happen on Friday was an announcement on a revision of social distancing measures that should have been implemented beginning in March. But it looks like officials have delayed that plan, and they are saying we will have a draft by next week, but a final date is not set on when these measures will actually start to kick off. And that, as we are still seeing numbers fluctuating between the 300s and the 600s. So we are still not recovering from the third wave of the coronavirus. Meanwhile, what's being reviewed in Europe is Korea's first homegrown antibody treatment for COVID-19 by Celltrion. It's the third antibody therapy being evaluated by the European Medicine Agency, and that according to the agency on a Wednesday local time. Now, let's take a look at the figures around the world, and let's stay with Europe. Now, while the UK is seeing declines in daily figures below 10,000. Now, what's worrying is here in France, which currently has a total of 3.6 million infections. It's over 31,000 new cases in just a day, which marks the highest figure in 3 months. And let's take a look at the global figure here. We have a surge in infections, over 446,000 infections in the past 24 hours, and also a rise in deaths, 12,000 new fatalities. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Back to you, Sunny.
All right, so thank you for that. Meanwhile, officials here are fine-tuning details related to securing, storing and supplying Pfizer vaccines that need super cold temperatures. For more on this, I have Lee Kyung-eun here in the studio with me. Welcome, Kyung-eun.
Hi, Sunny.
Right, Kyung-eun, let's begin with the cold chain efforts here on the local front for Pfizer's vaccines.
Yes, Sunny. So as you know, all vaccines are sensitive to temperatures, but the Pfizer vaccine is extra sensitive and needs to be stored at minus 70 degrees Celsius. That is why the Pfizer vaccines have been mostly sold to advanced countries that have adequate cold chain system, which can prevent the vaccines from being spoiled. So in Korea, this role is being carried out by an ultra-cold storage center in the city of Pyeongtaek, Gyeonggi-do province. Take a look.
This is the only facility in Korea that's capable of maintaining such ultra-cold temperature levels. So all the incoming Pfizer vaccines must be stored here unless they're transported directly from the airport to vaccination centers.
However, the first batch of Pfizer vaccines from the COVAX facility, which is due to arrive on Friday, could be transported straight to the National Medical Center, the country's main vaccination hub. This is due to the fact that the first shipment is very small and may not require extra warehousing. But the following batches, which are set to arrive in March, will all be stored here before being distributed to vaccination centers nationwide.
I see. Meanwhile, Kyung-won, I understand you actually went to this logistics center.
Yes, I did. The containers were actually built to store imported tuna. But since last October, the center has been emptying out the storage for the arrival of the vaccines. And now it has secured some 800 square meters of floor space, which can store enough Pfizer vaccines to inoculate some 10 million people. I was able to enter one of the two containers where the temperature can drop as low as minus 90 degrees Celsius, colder than winter in Antarctica. So I'm fully kitted out in protective gear to go inside the storage and see just how cold it is. Right now, the mercury is pointing at minus 73.6 degrees Celsius. Here, I have wet towels. And as soon as I pull this out, the water quickly freezes stiff. And it is extremely hard to breathe even with this mask on. Anyone entering the container can spend no more than 10 to 15 minutes inside due to the possibility of lung damage. That is why the vaccines are taken out of storage and packaged at a separate section where temperatures are milder.
I see, that's good to know. Now, this is the only facility nationwide that is capable of ensuring ultra-cold conditions, I hear.
Yes, the secret lies in LNG gas. More specifically, the center turns LNG from its liquid state to gas, during which extreme cold air is generated. And that cold air is sent to containers. Theoretically speaking, it is possible to create a similar low-temperature environment using electricity, but only for a limited time and space. Plus, the cost could be immense. By using an LNG cold storage system could lower costs by up to 80%.
Wow, 80%. Now, Kyung-won, surely maintaining the cold chain would be a difficult task while in transit.
That's right. That is why the government has teamed up with private logistic firms, military, and law enforcement. And together, they'll be maintaining a comprehensive cold chain system from transportation to storage, which include cold chain trucks. And SK Bioscience will be in charge of monitoring the process using the latest in cutting-edge technology.
We are planning to set up a central command center equipped with the Internet of Things to track the locations of the vaccines and their temperatures in real time.
Also, the trucks carrying the vaccines will be escorted by the police and military in case of any emergency on the road. And as we just heard from Commissioner Chung Eun-kyung, there is a system in place to monitor the vaccines in real time. This allowed the government to detect temperature glitches in a batch of AstraZeneca vaccines, which was headed to Jeju-do Island last night. It immediately retrieved the vaccines and sent out a new shipment, which safely arrived on the island on time as planned.
Right, Kyung-won, that is quite impressive. All right, then, thank you for that report.
Thank you for having me.
Right, it's time now for the regular briefing on the pandemic situation here in Korea for this Thursday. The current COVID-19 prevention measures come to an end this weekend, on Sunday to be precise, and authorities are looking to revamp social distancing guidelines for the days ahead as we launch our inoculation campaign tomorrow. But as Soa mentioned, the exact date has yet to be decided. The briefing is about to start. We'll come back to you afterwards.
First of all, we have Director Lee Sang-won with the briefing. Let us now begin our regular briefing on the COVID-19 situation here in South Korea for February 25th. As of today midnight, we have a total of 369 new local infections and 27 new imported cases. With this, the total caseload now stands at 88,800, and 16. And we have 7,448 people remaining in quarantine, while there are 144 patients with severe or critical conditions, which is up by 4 from the day before, and we had 5 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And let us now look at the major updates of our domestic infections. We had 369 new cases being reported. With in the capital area, we have 268 cases and 101 in non-capital area, 20 in Chungcheong area, 21 in Honam area, and also 21 in Gyeongnam area, and 2 in Gangwon province, and also 5 in the Jeju Island. And also by region, here are some updates on the domestic infections, beginning with the capital area in Seoul's Yangcheon-gu district. In relation to a family, we also have 12 additional cases being confirmed, and in total, we have 13 cases being confirmed to date. And in Seoul's Gwanak-gu district, in relation to a new social gathering at an office space, we also have 14 additional cases being confirmed, raising the total to 15. And in Seoul's Seocho-gu district, in relation to an hospital, we identified the first case on the 20th, and we have 9 additional cases, raising the total to 10. And in Gyeonggi-do Province, Namyangju City Plastic Factory, we also have found 3 additional cases being confirmed, and in total, we have 187. And in relation to Gyeonggi-do Province, Bucheon City, in relation to the Victory Altar, we have 13 additional cases, raising the total to 174. And in Gyeonggi-do Province, Seongnam City, in relation to a nursing hospital, we have 7 additional cases, raising the total to 67. And also in Seongnam City, in relation to ballroom dancing, we identified 7 additional cases, and in total, 77 have been confirmed to date. And in Gyeonggi-do Province, Yongin City, in relation to an athlete meeting, we also have 7 additional cases, raising the total to 52. And moving on to the Chungcheong area, in Chungcheong, Namdo Province, in Asan City, we have the boiler factory with 3 additional cases being reported, and a total of 186 have been confirmed. And Honam area are as follows. In Gwangju City, in relation to the call center at Seogu, we have 13 additional cases, raising the total to 38. And in Gwangju, Gwangsang-gu district, we have the family gathering. 3 additional people have been confirmed, and in total, we have 18 cases being confirmed to date. And in Jeonbuk, Kunsan City, also we have a family gathering. We identified the first case on the 22nd, and we have 10 new cases, raising the total to 11. And Gyeongbuk as follows. In Gyeongbuk, Uiseong-gun County, in relation to the second family gathering, we have 5 additional cases, and a total of 6 have been confirmed to date. And also in Uiseong-gun County, in relation to the family gathering and hot spring, we have 9 additional cases being confirmed. A total of 95 have been confirmed to date. And Gyeongnam Province are as follows. In Busan City, in relation to the Bukgu funeral home and also a golf club in Ulsan, we have also 4 additional cases, raising the total to 46. And Gangwon-do Province, in Gangwon-do Province, Jeongseon City, we have a church where we have 31 total cases being confirmed to date. And also we have some updates on the new variants here in South Korea. After the 22nd of February, we have 14 additional new variants being identified here in South Korea. And with this, we have 142 being confirmed, and 14 are South African, and 6 of Brazil, and 102 from Britain. And here are some more updates of our findings. We have 12 cases being imported cases, while 4 have been confirmed at the points of entry, while the rest of 8 have been confirmed while on quarantine. And also 2 were local transmissions, and both of them were foreigners. One in relation to the foreigner family meeting and relatives meeting as well. And also to this end, the quarantine authorities would like to also intensify our quarantine measures for all inbound travelers and all of those who are traveling to Korea as well as their immediate families. We ask you to also comply with the quarantine measures strictly until the day of the easing of and just being discharged from these self-quarantine. And we will be rolling out our vaccines very soon, and we have high levels of hope as well. And we believe that until the day we have a visible decline in the number of cases, we will be carrying out testings and tracing as well. And to this end, we will also designate areas as subject to the mass testings, and we will also cooperate with the KCDA, and we will be disclosing such details soon. And this is also in line with a very important, crucial time of moment here in South Korea, where we are about to roll out our vaccines. It is all aimed at curbing further local spread. And right now, we will carry out the vaccinations and the massive testings, and we also need to have treatments. And we believe that these comprehensive approaches are very important. And at all circles and corners of life, we have many medical staff members and related officials who are exerting their full efforts. We are having a prolonged COVID-19 battle for over a year. We know that this is raising the level of fatigue, but we ask for your cooperation going forward as we take another step forward. And to this end, we see many cluster infections nationwide. We will also exert our full efforts to stabilize them going forward. Still, we see our new daily tally hovering around 300 to 400. Plus, we also have the rapid spread of the new variants globally. And here in South Korea, we cannot never let our guards down as well. It is a very pity, and I have a grave sense of responsibility as well as a quarantine official. Please also exert vigilance going forward and comply with the antivirus measures to protect yourself and your loved ones. And ahead of the new school year beginning very soon, we ask you to also help us ensure a safe school year and a new semester for our schoolers nationwide and comply with the quarantine measures as well. And ahead of the inoculations, we have been providing details of the people who are eligible for the vaccines as well as the transit of these vaccines. We will also provide further information.
그럼 정경실 예방접종관리반장이 일상 회복을 위한 코로나19 예방접종이 시작됩니다라는 제목의 보도자료.
We will also have a special briefing session on the COVID-19 inoculations coming up. And with the COVID-19 inoculation to start very soon, here are some details. The COVID-19 vaccination will begin at 9 a.m. February 26th, Friday. And on the 26th, we will be carrying out people below the age of 65, and they will be the residents and healthcare providers at the nursing hospitals and nursing homes. And on the 27th, we will begin inoculations for healthcare providers who treat COVID-19 patients. And also, as for the first providers and high-risk hospitals, we will also rolling out vaccinations starting from March. And to this end, our team, also in relation to the variant vaccinations, we will also have our control and management database, and we have been carrying out the consent area as well. And we have been carrying out also looking at about 4,000 4,000 people who are staying at the nursing hospitals. About 93.7% of them have agreed that they will be vaccinated. And we also have seen hospitals who are treating COVID-19. And as for these hospitals, we have looked into 143 hospitals, and we also saw 55,000 people, doctors who have been agreeing to the vaccinations as well. So this is about 95% of them. And as for the high-risk group and the first responders, until we will be carrying out their consent until the end of February, and this will be also disclosed very transparently going forward as well. And to this end, our committee is also trying to ensure a smooth vaccination for all of those people who have been agreeing to get the vaccinations, and we have provided detailed guidelines. And as for the residents and caregivers at nursing hospitals, they will be injected with AstraZeneca's vaccine, and they will be completed with vaccinations before in March. And also, as for the SK Bioscience, this is the manufacturer who is developing these vaccines, and starting from today for the next 4 days, they will be moved and delivered to the vaccination centers nationwide. And also on the 26th, starting from midnight, we also will have about 16,000, that is, we will have these doses to be delivered, and until the 28th, we will also have about 280 public hospitals and 2,200 of the nursing hospitals to receive these vaccination doses. And as for the nursing hospitals, they will be receiving these vaccines directly. And as for other facilities like long-term care centers, these vaccine doses will be delivered to the public health center, and also they can pick them up at these respective centers, or they can also visit the health center to get inoculated. And also upon arrival of the vaccine, they need to get vaccinated within 5 days. And within March, we will complete the vaccination of the first group. And on the 26th, on the first day of the vaccinations, we will be carrying out the vaccinations for 5,600 people at 230 hospitals and nursing hospitals, that is. And within the next 5 days, all of the other nursing hospitals in Korea will also be administering their vaccines as well. And we also have the COVAX facilities, Pfizer vaccines received here in South Korea, and these inoculations will be completed by March 21st. And as for the Pfizer vaccines arriving here through COVAX facility, they will be arriving at the airports, and also they will be moved to 5 different vaccination centers. And starting from 8th of March, we will also be distributing them to each of the local hospitals. And during the first week, we will carry out the vaccinations at the vaccination center in the public national medical center, and we will also have trainings and hands-on education for the healthcare providers. And on the second week, we will also carry out trainings for other healthcare providers at hospitals as well. And on the 27th of February, we will have the inoculation center and at the medical hospital, and we will also have about 101 doctors, and a total of 300 people will be being administered with the shot on the 27th. And later on, these vaccinations will be carried out at our local levels. And as for the high-risk hospitals and the first responders, we will be first complying and compiling the list of the eligible people. And by March, we will be delivering the vaccine doses. And by end of March, the inoculations for these group of people will be completed. And going forward in March, we will also reflect any of the changes and revisions, and we will also provide a monthly plan after the consultations with our panel of experts. And our committee is also, in order to ensure a smooth vaccination of these COVID-19 vaccines, we will be carrying out adequate training, as well as adequate systems and protocols and guidelines. And as for the designated COVID-19 hospitals, we will be having and set up regional and central vaccination centers, and we will also provide a role model for these, and we have been given them certain guidelines as well. And for Daegu and Gyeongbuk region, we have also opened one of the local and regional vaccination center at an early stage. And as for the nursing hospitals and hospitals which will be giving their own shots, we have signed a special contract with them. And during the initial stages of inoculation, we will be asking the staff members members at the nursing hospitals and the designated hospitals who have signed the special agreements. So they will be providing the vaccines to the recipients. And going forward, we will also expand this group of people afterwards. And by conditions of the regions, we will also mobilize private nurses as well as the military doctors as well. And we will also mobilize military personnel as well. And as for the medical professionals, we also will provide online video sessions. And right now, a total of 70,000 people have been completing these training. And we also have had a similar clinical training session with our Korean Nurses Association. And also, we have been giving out detailed information kits to these medical professionals as well. And moreover, the committee also opened up a special data system, and we have also looked into the process, and we have provided these guidelines. And first, we have provided the registration of those people who are eligible for the vaccination. So we have a list of people who will be get vaccinated, and so we have this full control of the list. And upon the inoculation, they will be able to look themselves up on the list, and they can print out their slots as well. And this has also been operated starting from the 24th of this month. And in order to have a clear reports of any side effects, we also have provided the vaccination 누리집, which is a data kit to the people as well as the hospitals, so that we can help hospitals and public health centers to also respond necessarily to any side effects that the responders have. And moreover, any of the residents, they could also have issuance of the certificates both in Korean and English. And we will also have a digitalized vaccination certificate going forward as well. And on the 27th, we will also have the accumulated numbers of the vaccinations, and we will also disclose detailed information transparently with our 누리집 document. And if you have any increase of the COVID-19, please contact our hotline at 1339, or please refer to the COVID-19 vaccination 누리집 data. And the vaccinations to be inoculated to the people, we also have been carrying out 3 times of the experts panel being approved, or they have been approved by the WHO. So globally, many people have been inoculated with such vaccines. So in order to reach herd immunity, if you are eligible for the virus, we ask for your proactive participation in the inoculation process. Moreover, during the past year, we have also highlighted the importance of personal safety and also the social distancing measures. We thank you for your participation. We ask you to participate going forward as well. Thank you very much.
Right, the briefing today included details about the COVID-19 cases for this Thursday, as well as details about the vaccination campaign.
Yes, so let's start right there. Jung Kyung-sil, an official in charge of vaccine management, had some details on the vaccination process, including details on the number of how many people will get inoculated first, and the distribution process, as well as the education and training of the vaccination process. Now, first, on Friday, 9 a.m., the vaccination will kick off simultaneously across the nation for people at nursing homes and nursing hospitals under the age of 65. And on the 27th, it will start for medical staff that are treating COVID-19 patients on the front lines. And in early March, it will start for high-risk medical facilities. And she also mentioned that from beginning today, for 4 days, the AstraZeneca vaccines will be distributed to these facilities. And just a quick update on what Lee Sang-won, the official, earlier mentioned on variants. It looks like we have 14 new variants reported since the 22nd of February, which raises the total to 142.
I see. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Also here in Korea, efforts are underway to secure special syringes that can extract an extra dose from Pfizer's vial of the COVID-19 vaccine. The global demand for these syringes has surged in recent days amid limited production capacity, and many are working to prevent this reality here on the local front. We have details in this report.
Korea is preparing to usher in a new era of hope, with its long-awaited vaccination campaign scheduled to begin on February 26th. Korea is also looking to ramp up production of special syringes that can draw more doses from a single vial of Pfizer's vaccine. To learn more, we visited this manufacturing plant located in the city of Gongju in the central region of Korea. This factory is running in overdrive to produce special syringes as it tries to meet the growing demand.
이쪽에 있는 주사기가 LDS, 즉 Low Dead Space 주사기입니다.
These low dead space syringes minimize the amount of vaccine left in the device after injection.
일반 주사기 같은 경우는 주사가 완료되면 이 파란색 있는 허브 안에 약품이 좀 남게 돼 있습니다. 저희 LDS 주사기는 반면에 그런 공간이 없도록 구상이 돼 있고 주사를 하게 되면 이 안에 공간은 유일하게 바늘밖에 없기 때문에 버려지는 양이 거의 없는 주사기가 되겠습니다.
Around 0.07 milliliters of the vaccine trapped between the plunger and the needle are wasted after each injection with a conventional syringe. In comparison, only about a third of that is lost in LDS syringes. With one vial from Pfizer containing 2.1 milliliters of its vaccine, this corresponds to 5 doses for conventional syringes, but an additional dose can be extracted using LDS syringes for a total of 6.
신한양행의 최소 잔류량 LDS 주사기는 월 500만 개를 생산하고 있습니다. 그중에서 250만 개는 국내 질병관리청에 납품 예정으로 계약을 체결하였고 150만 개는 기존의 미국 거래선에 수출하고 있습니다. 현재 유럽, 동남아, 중동 등의 많은 국가에서 저희 LDS 주사기를 구매하기 위해서 연락을 해오고 있습니다. 수요가 많이 창출될 것으로 예상하고 있습니다.
LDS syringes have become a valuable and highly sought-after commodity since the start of global vaccinations. The United States, which began its inoculation campaign last December with Pfizer's COVID-19 vaccine, is scrambling to get as many LDS syringes as it can find.
Because we in the US weren't necessarily thinking about syringes as being a possible bottleneck for vaccine distribution, it's any help that we could get in getting more of these LDS syringes would be super great. I don't know if that is something that the US government is pursuing. I know they've been looking into bolstering up LDS syringe production from companies within the US.
Certainly an increase in the number of shots that you can give per vial, so to speak, is extremely important.
Meanwhile, neighboring Japan has been forced to discard millions of Pfizer vaccine doses due to a shortage of LDS syringes.
重要なワクチンでございますので、廃棄ということになっては大変でございますので、今6回取れるような針あるいはシリンジを調達すべく。
The Korea Disease Control and Prevention Agency says it has secured 40 million LDS syringes for the country, and that it was made possible through close cooperation between the public and private sectors.
세 업체 모두 많은 나라에 최소 잔유형 주사기를 공급함으로써 세계 각국의 코로나 극복에 크게 기여하게 될 것입니다.
These LDS syringes may help us get the most out of our vaccines at a time of global supply shortages when every drop matters.
(1차) 접종 시 또는 코로나19 백신 구성 성분에 대한 아나필락시스와 같은 심한 알레르기 반응이 나타난 경우에는 접종을 받으시면 안 됩니다. 또한 코로나19 백신별 1차, 2차 예방접종 간격은 반드시 준수하고 동일한 백신으로 접종을 해야 됩니다. 코로나19 임시 예방접종에 한해서는 국가보상 제도의 신청 기준을 기존의 본인 부담금 30만 원 이상에서 전액으로 확대 적용하는 등 국가보상 제도의 피해 보상 범위를 확대하여 운영할 계획입니다.
We continue with our focus on vaccination efforts here and elsewhere as we prepare to launch our vaccination campaign tomorrow with AstraZeneca's vaccine and on Saturday with Pfizer's vaccine. For more, I have Dr. Yu Byung-uk from Suncheon University Hospital. Welcome back, Dr. Yu. And I also have Professor Chung Sun-jae from Yonsei University. Good to see you again, Professor Chung.
Thanks for having me.
Dr. Yu, authorities held a special COVID-19 vaccination briefing yesterday. Could you start by telling us a bit about the protocols involved with regard to the vaccination process?
So actually we are get used to who has the children we are bringing to the clinic for the vaccination or yourself. We do the screening questionnaire for the vaccination. We are get used to. We just fulfill of this and 1 or 2 minutes for the short consultation with the doctors about your condition. After the vaccination, 15 minutes you can stay there watching your condition, any case of the side effect like anaphylaxis. But one thing is a little different thing. Usually we do the screening, after that we giving the vaccination, but this time we can waiting for the doctor's decision. You can have vaccine the right same day, or they delay a certain another date, or better to stop, and we can have other opportunities.
I see. Now, you just mentioned anaphylaxis. It's something that Commissioner Chung Young also mentioned in the video we just saw. What are the symptoms of this reaction and what should be done to address it?
Well, anaphylactic shock is kind of serious allergy reaction. So first of all, we can have hives, rashes, sometimes itchings, and the kind of shortness of the breath or swollen lips. It can be happen, usually we call the penicillin shock or the peanuts or the shell, something like that. But I can tell anaphylactic shock, we can handle it with our hands more than 100%. I can guarantee. Why? This usually happens with 30 minutes. So if you can stay there around the 15 to 30 minutes where you have a vaccination, we can use the epinephrine, which is a very simple one. Even though we can bring in like the portable one for if your children have the anaphylactic shock and experience before, we give them to bring the shot into their muscles. So anaphylactic shock can be handled if you have a condition. But before you have the experience about this, please be unknown to doctor with the screening questionnaire and we can prepare about it.
I see. Meanwhile, Professor Chung, as part of efforts to boost public confidence in the vaccination campaign, authorities are looking to expand compensation coverage for those who may suffer from deadly consequences of the vaccines. Tell us a bit more about this.
Yes, actually the KDCA has been announced the compensation amount will be increased to like 400 million won, which is 3천만 won in the case of vaccine-related death or the severe disability. And when you have the mild disability, then it'll have like 55% of the original amount. And I think this policy is targeted for the people who will be anxious about getting the vaccine. And I think it is pointed out that not all will be paid because of this application, because we have the process of the revealing causality, including the committee, and also this other compensation would really need kind of like a paperwork. So personally, I don't think this single item will make the much expected increase in the vaccination rate. So I think it'll be more needed to lower the threshold of the compensation system, and also the public education should be made simultaneously.
Right. And Professor Chung, what are some of the safety measures that need to be practiced after the first dose of the COVID-19 vaccine?
Yes, actually, it needs about 2 weeks to get the expected rate of the immunity from the first vaccination. So, so even if you receive the first shot, you need to follow the same quarantine measures as before, like wearing face mask or the washing hands or social distancing. And also, after the vaccination, some reports report that there could be some symptoms like a fatigue or headache or muscle pain, which could last at like 3 days at the longest, and then it will be disappeared. However, if it proceeds to some more severe symptoms, such as respiratory failure, then you should also consult with the medical institution.
Of course. Dr. Yu, as we saw earlier in the video, medical experts claim the use of special syringes for the Pfizer vaccines will seek to make most of the current available supplies, given the production challenges and rising global demand. Do you agree?
Absolutely. This the low death space one is kind of a little tricky techniques, but it is essential help because these days we can call method of the squeezing. So usually they prepare for 1 vial for the 5 persons, but if you use this special syringe, it make like one more person can have it. Before you have the meeting with this, Arirang, they showed that this is kind of miracle techniques, but actually this is kind of squeezing way to go. So we can have these days, general, universal shortage of the vaccination. It's the simple syringe can help to 20% more of the increase. It's like more producing the vaccination.
Right, and staying with that, Professor Chung, medical workers over in the US have found significant amounts of leftover vaccines in almost every Pfizer vial after extracting even the 6th dose. And some, therefore, are calling for pulling of these vaccines. But authorities here, as well as over in the US, have agreed that leftover vaccines cannot be combined. What are your thoughts on this?
Yes, actually, this KDCA has also been announced about the vaccination guideline at the February 24th. And the handling policy was like the number of possible vaccination per vial and also the method of extracting the injection after opening. And the principle is that once the vaccine is open, then it should be used on the same day, and then the remaining amount should be discarded. So, for example, like AstraZeneca, they use like 10 doses per vial, and like for Pfizer, they use like 6 doses per vial. And then it could be extracted, like the Dr. Yu said, LDS, to minimize the remaining amount. However, when they're left over, then people are guessing that this could be like wasteful. Why don't we just use this? However, there is a higher chance about the bacterial infection. So for the general view, maybe we can save some for the population. However, we can handle this greater risk of the bacterial infection is left. So I think it's better to discard as in the principle.
I see. Meanwhile, Dr. Yu, in today's afternoon briefing, we heard that Korea has recorded 142 cases of the variants. And speaking about the variants, what has been disclosed thus far regarding the efficacy of our current vaccines on the UK variant?
Well, like today's, we have 2 options now, AstraZeneca one and the Pfizer one. AstraZeneca one is made by the Gov'T types. Gov'T type actually, I can tell, long trend. Long trend means it's very difficult to switching properly. But anyway, it's safe and working hard and longer. But mRNA one is the short, but it's new brand car. We can switch to the new passenger, the new antigen against the virus. Only 6 weeks to go to can change. So now it's a very less case of the variant in Korea. Pfizer one and AstraZeneca still working. But if we need some new weapon, new strain, probably we can get in November or early of next year. We can properly respond about it.
I see. Right, perhaps a greater challenge against the efficacy of our current COVID-19 vaccines is the South African variant. Now, for more on this, we spoke to another established scholar who partook in a related study with experts at Pfizer. Do take a look.
Recently, we published our results together with Pfizer in the New England Journal of Medicine last week. We found that the blood collected from the Pfizer vaccinated human still able to inhibit the South African variants. The South African strain is 2/3 less sensitive to the vaccinated serum blood. And for example, let's say the Y-type virus, the neutralizing titer against the Pfizer-derived vaccine blood is 600, the titer. the higher the titer, the better would be for protection. And now, against the South African strain, it loses 2/3. That becomes 200, right? And then 200 is still active in inhibiting the South African strain. But for the scientific field right now, we still don't know what is the minimum antibody levels is required to be able to be protect us from infection. We still remain to determine what is the minimum requirement of antibody levels to protect us. But based on some of the data from Pfizer and Moderna, so overall, I think it still remains to be determined in the clinical setting that whether the Pfizer vaccine or the other vaccine will be protective against the South African strain. But based on the laboratory results, we still think it still be able to protect us from the South African strain.
Right. Professor Chong, as we just heard, Professor Pei-Yong, she appears to be fairly optimistic about the efficacy of the vaccine on the South African variant. What are your thoughts?
Well, actually, I have to tell about the numbers and the actual data from an epidemiological study, and they were performed among 2,000 healthy adults, and only 10% show the protective effect for the mild outcomes. However, in this study also, they didn't check the severe outcomes such as mortality or like the severe disability. So, I mean, we need more time to get the conclusion. However, I think we have to be worried about this variant situation, and because it's always possible that the new vaccine comes out and also the new variant comes out, and it was like the war of the time. So I think we should be more alert and stay tuned to this the situation.
Right. And Dr. Yu, speaking very briefly, what are your words of advice in boosting public engagement in our vaccination campaign that kicks off tomorrow?
Well, we believe we will win finally against COVID-19 with hands in hands. So your small participant finally is gaining the big weapon against COVID-19. We are welcoming your hands.
Right. All right, Dr. Yu, as always, thank you very much for your thoughts. And Professor Chung, thank you for being with us today.
Thank you.
Right, on that note, we end our coverage for today. Do join us again tomorrow for more on day one of Korea's public inoculations. Thank you for watching.